first day of spring is less than 24 hours away now, and for a lot of people, so many people, that means allergy symptoms are flaring up. And after experiencing a warm winter, your spring allergies will be coming on earlier and unfortunately stronger. So joining me right now in Studio 61 this morning, Dr. Walsh with Hartford HealthCare. We're talking about allergies. As I mentioned, so many people are frustrated by them. It causes so many people just extreme discomfort. What is the best way for people to deal with them?
So allergies are tough because the pollen obviously becomes almost ubiquitous. So one of the first steps is to try and decrease exposure, which means if you're working in your yard, going on a hike, it might be a good time to actually wear a mask, as crazy as that may sound, in order to decrease the amount of pollen you breathe in. You also have to be careful what comes into your house. So you don't want to go outside and bring in your shoes, even your pets when they come inside. You might want to wipe them down to get some of the allergens off of your pets. Leaving windows open can also be problematic, especially on windy days. So all of that you have to think about. And even showering before you go to bed is a good idea, because if there are any pollen or allergens on you, you put them on your pillow, you're going to be exposed to them all night. So all of those first steps are what's most important.
Is pollen the most common allergy in the spring?
Pollen is one of the most common allergens. Yes, it's again, it's budding, everything's growing, and so of course everybody gets exposed all at once, which is a part of the problem. And of course this can lead to more serious things. So as you get this increased production of mucus, as you get the runny nose and all of this extra fluid, it can get trapped and become infected. So there is it can actually become more than just simple allergies.
Are there any other allergens that might be affecting people, like mold for the spring, or is it?
Obviously, mold is all the time. Anytime you can be exposed to mold. There's some people who dander causes a problem. Some dust for some people will actually cause a problem. So any of those things environmentally can cause you to have allergy symptom flare-ups.
So what's happening with treatments right now? I mean, is this over the counter? Is that the best way to combat the symptoms?
First line of defense would be over the counter. Simple things like Claritin, Allegra, Zyrtec, those over the counter meds are actually good first line. If you know you have allergies, wise to start taking those meds before the allergy season kicks in full-fledged, so that your body already has the antihistamine properties. Benadryl is the strongest of all of the antihistamines, basically, but of course for many people it makes them drowsy. So you got to be really careful with taking Benadryl. Some people can take it Some people just take it at night to help them to sleep better and clear up the allergies. But antihistamines work. The other thing is to think about your diet. Simplifying the diet, a more plant-based diet might actually help as well.
Really? How so? Because
some of the animal products will have more of an allergen effect than plant-based foods will. So some people, even milk, they're lactose intolerant, which isn't an allergy, but there are other things that might sometimes trigger them to actually be in more of a hyper-inflammatory state.
So what foods would you say people should try avoiding?
One of the probably main ones, and it's not popular, but dairy. I'd honestly say milk, cheese. I'd cut down on those if you have bad allergies. And sugar, because sugar does mess with the immune system.
Oh, sugar is the devil, isn't it? It tends to be. All right, so I have a question for you. If people are experiencing like a prolonged cough or maybe a cold, could it possibly be allergies, even though they are unaware that they have allergies?
Absolutely. So some people will come into the office and say, hey, I've been having this cold for 6 weeks. Well,
right, like I've had a cough for about a month.
A cough all by itself you can have for an extended period of time, because that's just, your lungs can get inflamed and it just takes time for it to cool down. But when you're runny nose, sneezing, itchy-eyed, and that's lasting for weeks, that's no longer a cold, that's probably allergies.
So would you suggest someone go get tested?
Absolutely. You can go to an allergist, get tested. You can come into us first. A lot of times I tell people, check with us. We are Hartford HealthCare-GoHealth Urgent Care. You come in, we can look at you, make sure you don't have an infection, make sure it's just allergies, get you started on some meds, refer you to an allergist so you can get the proper testing. So you get a definitive diagnosis, then you can take more preventive measures than you might currently be taking.
Oh, this has been really interesting and informing. Any final thoughts before we wrap up?
Yeah, I would
allergies.
Please still go outside. Please still exercise.
Enjoy it, right.
Fresh air, the sunshine is real important. Be wise about your exposure. If you're someone who really has bad allergies, the early morning, the windy days are going to be the worst days. So kind of react appropriately because of that. Yep.
All right, doctor, thanks so much.
Thank you for having me.
We appreciate your time. Really good stuff, important information.